I'm here today to get an implant for a missing tooth I had. I never had this tooth here.
At the same time, while I'm giving you anesthesia, I'm doing something called bone sounding, figuring out exactly how much bone you have and the thickness of the bone.
I'm a dentist. I know where to go when I want to get done right.
It doesn't hurt, right?
They're specialists. They do it all day.
This patient is missing a tooth. It's tooth number 12. It's an upper left tooth he never had. And we're going to be placing a dental implant on him today. The only thing we have to worry about is the area in terms of how close the teeth are together, because he's had some movement in the past, and now he has had braces and they're able to move the teeth further apart. And by doing so, it creates a space for us to place an implant. So we're able to open up his gums just a little tiny bit. Not too large, large enough where we'll be able to place the implant in there. So here's a secret is we want to make sure right in the middle. We're going to take a check x-ray, meaning seeing how things will look in the future. That's perfect. In case we're putting a thinner type implant because the space isn't large enough for what we'd like to call a standard size, which is fine. And then now we do it by hand. Get more of a sensitive touch to this. Let's take an x-ray.
After the initial placement of the implant, Dr. Wang's assistant takes a routine check x-ray. With his trained eye, the doctor can easily see the implant is not yet deep enough.
You'll see what I mean later, once it's restored. Trust me on this. We have no choice.
The doctor did take a lot of x-rays and, came in and out and did a lot of things, but, I know why he's doing that is because he's a perfectionist and he wants to get it right.
I want the implant to be a little deeper, and the reason being is, based on the x-rays that I checked, where his gum line is, it wouldn't be naturally where it should be. Let's put it that way. So if we had placed the implant in where it was, we would get something that wouldn't look natural. So I'm trying to get this to function properly as well as to look naturally as well. Good. Set the heel, or get a final x-ray. Doing all right? Good.
You?
Yeah. Looks great. You didn't feel any pain, right?
No.
Everything was comfortable? Good. We got it in there. Now the whole secret is we got to let it heal.
That's the secret.
Okay.
It looks great on the x-rays, I know what a good implant looks like, and it looks pretty good to me. So it's actually, pretty painless and pretty easy procedure.
About 7 or 8 years ago, I had a tooth pulled. So instead of getting a bridge there, I decided that an implant was probably my best option. This way I don't have the bone loss or the teeth on the top don't drop.
All right. Open just a touch. This is pretty simple. You're not going to feel anything. Close your eyes gently. Beautiful. I love it. Joe came to see us a few weeks ago for initial evaluation. He had a back tooth taken out. What we're going to do is we're going to place one implant to replace that tooth rather than shave both teeth down and put a bridge over it. He's a perfect candidate for a dental implant. He's going to be able to floss, he's going to be able to feel good, look good, and chew very comfortably.
You comfortable?
Not too bad, right? Good.
Today is just the beginning part of the procedure where they're just going to basically cut the gums and actually put an implant into my bone to have something for the tooth to hold on to.
As far as the implant is concerned, it's one visit. It takes about 15 to 20 minutes, minimal to no discomfort. He came in today. We're going to put that implant in. The next time he comes to see us, he's going to get a tooth. Actually, this looks really good.
What I like about Dr. Rubenstein and Dr. Wang is that they made the pain as little as possible. Good group of guys, definitely know what they're doing.
And that's exactly where my implant's going to go. You can see it's in perfect alignment to where his teeth are. Love it. That's really nice, actually. Now that I'm happy with where my implant is positioned, where my guide pin is positioned, We're going to go forward for the next few steps to place that implant.
I believe that I'm just going to have a stud in there, and then several months down the road after it heals, then I'm going to have the tooth put in and they're going to finish the procedure.
And you could see that Joe's extremely comfortable. He's not moving at all. He's not squirming. He's happy. Right, Joe? You happy? Look at that smile. That's the implant. And we're going to be placing that in Joe's mouth. This is a very clean procedure.
The first thing that people look at is your smile, so it was really important for me to make sure that, I kept it as nice as possible and all my teeth were intact.
It's gorgeous. Suture it up, call it a day, and we're done. You okay?
Definitely.
Easy? The procedure is very straightforward, pretty simple and quick.
Yep, definitely.
Okay, good. Just to show you, the implant is in, it's solid, and it ain't moving. Okay, it looks great. The good news is, we're going to fill a space with a tooth without hurting the other two teeth, without shaving them down. Okay, we'll be able to put a cap or a crown on that one tooth in a few months. Okay? In terms of surgery, there are no more surgeries. Can't be any more simple. Okay? And the great thing is, these teeth are no longer going to collapse, and your upper teeth are not going to drift downward. Nice and simple.
Like many patients, Joe dreaded the dentist chair. But in less than 20 minutes, his procedure was over, and so was his fear of the dentist.
Honestly, I can't believe how easy that was. With a dentist, you don't know what to expect, and everyone's afraid, being in pain or making you uncomfortable, but not at all. Like the doctor said, I don't have to bother any of my other teeth, and I can't wait until I get the rest of the stuff done, and I have my tooth in, and I'm on my way.
Up next, watch how one implant can not only replace a missing tooth, but also correct old faulty dental work.
If I would have known that the procedure is so great, I would have done it years ago.
Did you know that today there is a healthy, permanent solution for patients who want to restore their ability to eat, speak clearly, and bring back the natural beauty of their smile? Dental implants could be the solution and are frequently the best treatment option for replacing missing teeth due to trauma or dental disease.
Dr. Wang, myself, and our staff are dedicated to helping people.
You stay well.
At Southeastern Dental Associates, our professional staff is ready to consult you and your personal dental situation. Whether it's for a routine dental cleaning or a sophisticated dental implant procedure.
We've been doing this for many years, and we're leaders in our specialty.
With 4 convenient locations in Boynton Beach, Miami Beach, Pompano, and Jupiter, our doctors use the most advanced techniques and technologies available to ensure you achieve the healthiest solution possible.
Dr. Wang and I are up to date with technology, and we pride ourselves in knowing today's newest and freshest concepts.
With many years in practice, our doctors have earned an outstanding reputation for providing high-quality, affordable periodontal and dental implant care.
I think most patients think there's going to be a lot of discomfort with the procedure, and there really isn't.
Both of them were just very gentle. They were really good.
Honestly, I can't believe how easy that was.
Call today at 877-987-4321 for your free X-ray and personal consultation with Dr. Alex Wang or Dr. Kenneth Rubenstein to see if you are a candidate for a dental implant. For more information, visit our website at floridateeth.com and take the first step to a happy, healthy smile.